Salt is often called the heart of every dish. But for patients with hypertension, it's also the heart of many concerns. How much is too much? We all need to know. Let's turn to an expert for clarity regarding ideal salt intake for managing hypertension.
So the question is good one. The thing is what WHO says, that is World Health Organization says, is we have to take at least 4 to 5 grams, that is 5 grams of salt per day. But we Indians are taking average 10 to 15 grams of salt per day. That includes namkeens, packaged items, packaged cold drinks, and outside foods, chats and all. So ideally we should cut the salt intake by just avoiding the salt substitutes, and do not keep the salt jar in on your table, so that you can avoid adding extra salt to your meal, and reduce have a green leafy vegetables, fruits more, so that to reduce the salt intake. And so this is how we should reduce the amount of salt per day.
Thank you, doctor. Your expert advice will empower patients to strike the right balance, savor their meals, and successfully get to goal for healthier blood pressure. One of my relatives has high blood pressure, but tracks it diligently twice a day, keeping a record to stay in control. While some friends tease him, it raises the key question: how crucial is regular BP monitoring, and what's the best way to do it at home? Doctor, please, could you share your expert insights?
BP monitoring ideally should start at home. You should keep BP apparatus at your home, that is digital apparatus. You have to check at least once a day if you are recently diagnosed to have hypertension, and at least if it is still uncontrolled, you should check at least 2 to 3 times per day. The only advice I should give is you should avoid tea, coffee and meals at least half an hour before you are checking blood pressure, and should be sitting ideally on a chair comfortably, so that you can check blood. That is the optimal blood pressure, and your legs should be touching your ground. So this is how you should check routine blood pressure at home.
Thank you, doctor, for clarifying this important topic. Your guidance inspires patients to take control and confidently get to goal with their blood pressure targets. Exercise is often called the best medicine, but is it the same for hypertensive patients too? If yes, which type of exercises are recommended and which are to be avoided? It's so confusing. Let's ask our experts for insights on the role of exercise in managing high blood pressure, and whether there are specific types or durations of exercise recommended for better control.
Exercise has definitely a good impact on reducing blood pressure. Whatever exercise, as you said, it can be cycling, swimming or walking, or doing strengthening exercises. Whatever exercises, you should do at least 5 at least per week. You should do at least 5 days per week. That is a regular exercise. So definitely the exercise is going to reduce your blood pressure. It is definitely going to help to cut down your BP tablets and to lead a healthy and longevity life.
Thank you, doctor, for highlighting the critical role of exercise in managing hypertension. Your advice will help patients incorporate the right physical activities into their routines and stay on track to get to goal with the blood pressure targets.